Hi, this is Dr. Baxter with the Alabama Tongue Tie Center. We're going to talk about tongue and lip ties for speech and feeding. So, what is a tongue tie? A tongue tie is a too thick, tight, or short remnant of tissue from fetal development under the tongue that restricts normal tongue movement and causes a functional issue. The symptoms the child has are more important than the appearance, so a full assessment of related issues is the key to diagnosing a tongue tie properly. Having a patient stick the tongue out is the worst test to determine the presence of a tongue tie. Elevation or having the patient open wide and lift the tongue to the palate is the best quick test, although a better evaluation is needed. Elevation or lifting the tongue is the critical movement for the key activities of nursing, swallowing, and speaking. A lip tie is a remnant of tissue that is abnormally tight or thick that causes difficulty lifting the lip as required for nursing, feeding, speech, or for cleaning the teeth. It also can cause a gap in the teeth, and if it's wider than 2 millimeters, it may need to be released and will not likely close on its own, especially if another functional issue is present. And always, if it ain't broke, don't fix it. So for the appearance, children's tongue ties can appear very tight or only mildly tight. The symptoms and the function are much more important than the appearance. So all these strings under the tongue were causing problems in these children, even the ones that didn't appear as significant. So main issues with tongue ties. So the main issues with tongue ties. Healthcare providers are not taught about tongue ties in medical or dental school. There's lots of myths and misinformation passed down about tongue and lip ties as well, such as they don't exist, especially posterior tongue tie, just because it's harder to see. They don't cause problems with speech or feeding or nursing. The frenum will stretch or the child will fall and rip the lip tie eventually. A quick snip with scissors will fix the problem. You really have to do multiple follow-up cuts to get a full release with scissors. Or another fallacy is that a baby or child will need general anesthesia or sedation to treat, which just is not true. Many babies also have nursing difficulties that aren't resolving. Speech issues, R's, L's, S's, SH sounds, TH sounds, speech delay, mumbling, baby talk can all be issues. Airway issues because the palate and the nasal cavity is not expanded. Snoring and sleep-disorder breathing in kids and adults. Feeding issues like difficulty transitioning to solids, swallowing food, slow eating, picky eating, and also reflux. Dental issues in the future, so cavities, a gap, narrow palate, braces, and then mouth breathing leading to ear infections and enlarged tonsils and adenoids is also very common. So what are the main speech issues? So difficulty with sounds that require tongue elevation, S, Z, T, D, L, and R. Sounds in the posterior of the back of the mouth, G, K, and Ng. Baby talk, so they can't speak clearly or quickly. They stutter, or they might lisp or slur words. Also, speech delay can occur if the tongue has impaired mobility. Although some think that releasing a tied-down tongue is, quote, controversial, we observe a difference daily, and others do nationwide. Common sense also suggests a restriction in the main muscle involved in speech production would have an effect on the speech. Can you run a race with your shoes tied together? So what feeding issues are there? Very picky eating, we see, especially with textures like mashed potatoes, meats, etc. Slow eating, so difficulty swallowing leads to slow eating, and then they get distracted while eating. They also might have trouble gaining weight. They also pack the food in their cheeks like a squirrel. They may spit out food or refuse food. They may swallow whole with very little chewing. They can have reflux and constipation from undigested food. They might gag on foods. They can't eat an age-appropriate diet, and many other issues. Sleep issues could also be a problem. So sleep disorder breathing or sleep apnea is very common in children and often misdiagnosed or not diagnosed. Restless sleeping or thrashing around, they're snoring, waking up not feeling refreshed, they might have bags under their eyes, waking up often during sleep, may have trouble with bedwetting, tooth grinding, mouth breathing, or they sleep in strange positions. Can all point to a possible sleep issue. A few other correlated issues: if you get poor sleep or fragmented sleep, you can also be predisposed to ADHD or ADD. Sensory issues, tooth decay, open bites, tooth grinding during the day also, tongue thrusting, high or narrow palate, and also the palate is the floor of the nasal cavity, so that can impair your sinuses. You get lots of sinus infections, you get lots of ear infections. Neck and shoulder tension or pain is also common in children. Headaches or migraines, and finally mouth breathing. So what are the advantages to using the laser? So the lasers have minimal to no bleeding. It's often less painful afterward than scissors or scalpel. It's more precise and a better visual field during surgery. There's been no documented cases of infection, improved wound healing, less scar tissue. It seals the lymphatics. There's less swelling. It's very effective with good case selection. There's no need for general anesthesia or sedation, and also local anesthesia with just topical numbing jelly or injected lidocaine is often sufficient, depending on the age. So for healing, the oral wound healing is rapid, so it heals by, quote, secondary intention. So we want to encourage tongue movement as much as possible. There'll be a wet scab that can look like an infection or pus, but it's not. There's increased drooling is common. Motrin is typically the best for pain, but you can also alternate Tylenol and Motrin. It's sore for about 2 to 3 days, but then it's much improved by the 5th day. You can also call me if any concerns arise. And you'll have my cell phone number. So for aftercare exercises, it's really important to do some exercises and stretching to strengthen the muscles that haven't been used and now have increased range of motion, or it could grow back together possibly. So myofunctional or tongue exercises are the key to a good result and should be performed as long as possible. At least 3 weeks, probably 6 would be better. There's some sample exercises on the next slide, but the wound stretching or molding to elongate the wound, we try to trick it to heal open, should be performed for probably about 3 weeks. So the parent should either wash their hands or wear gloves, put a finger at the top of the diamond wound, and lift the tongue up and back to put tension on the wound. Sometimes you can put a second finger at the bottom of the diamond just to make sure it's elongated. There'll be some bleeding, possibly if the wet scabs heal back together and it's reopened, but it's better to do that than have it heal back together and have to repeat the procedure. We'll also schedule the patient for a follow-up visit at 1 week to assess the healing, and if we need to, we can do a deeper stretch. But the better the wound stretching and the exercises are performed, the less likely the need for a deeper stretch at that 1 week follow-up. So what tongue exercises can we do? A myofunctional therapist is a great asset and is part of the treatment team. So please ask us for references if you do not already have one. Sample exercises to help with healing are described below, should be performed 3 times a day or more often if desired. Ideally, 3 or 5 times a day, 7 times a day, just whenever you can. So stick the tongue out all the way to a point, scraping the edge of the top teeth with the tongue, and then pull back and lick the top of your palate 20 times, just as many times as you can. Stick the tongue out all the way to the left, all the way to the right, and then touch your palate. Do that 10 times. Push your tongue into the cheek on the right side, looks like a gumball. 10 seconds and hold it for 10 seconds. Then go to the left cheek, hold for 10 seconds. Stick your tongue out down the chin as far as possible, hold for 10 seconds. Now you can also suction the tongue to the palate, open widely, and hold for 10 seconds or make clicking noises. So finally, we do not guarantee results, and it's not 100% effective. Speech or feeding therapy and performing exercises is definitely required for improvement. We make our diagnosis based upon functional issues for the child and related symptoms the child may be experiencing, combined with the clinical exam and amount of restriction present under the tongue or lip. We do our best to achieve a full release even after it may have been clipped incorrectly 1 or several times by another method. We use the latest technology, protocols, and most current methods to provide our patients with the best results and experience possible. We also try to educate parents to ensure the child has the best chance of a good outcome by partnering with colleagues like speech therapists, occupational therapists, myofunctional therapists to perform the bulk of the rehabilitation and help the child achieve normal function. So the release is really just an adjunct to therapy treatment. If you'll have any other questions, please let us know. We're so glad you're here. Thanks a lot. Bye-bye.